And good afternoon, everyone, and welcome to tonight's AIDS Call-In Live program. My name is Kendall Moore. I am the Director of Operations for the Southside Help Center. In addition to that role, I also serve as the Pharmacy Sales Representative and Community Liaison for the AIDS Healthcare Foundation. AIDS Healthcare Foundation, from this point moving forward, we will refer to as AHF. And we're relatively new in the Chicagoland area. AHF has a tremendous history. We're the largest AIDS service organization in the United States of America and comparably worldwide. We are located in 36 countries, and part of our mission, and a lot of it, includes healthcare advocacy, research, and making sure that folks who are impacted and or affected by HIV and AIDS, that they have a place that they can really rely on. Particularly given the landscape of where funding is right now, AHF, we really pride ourselves on individuals being able to, regardless of their ability to pay, is the word that I would like to use, that they have some place that they can come and receive services at a very modest and or adequate rate, price, in addition to the type of services that we are providing. With regards to healthcare and comprehensively what we do, for individuals who are impacted by HIV and or AIDS, we provide direct services as it relates to case management, as it relates to primary care, as it relates to advocacy, transportation, and anything else up under the sun that an individual would necessarily need who is impacted and or affected by HIV and AIDS. I'll get a lot more into what AHF does as far as advocacy is concerned as we continue on through tonight's program. Of course, this is a call-in show, and you can give us a call, and we will take your questions at 312-738-1060. But in the meantime, I would like to introduce my guests, as I know that we are up against the clock. This evening, we are pleased to have Miss, and for a lack of a better term, folks, and she's very modest. We just finished talking while we were in the green room, and I don't want to put her on the spot, but I did find out she was one of my servers. And we are pleased and welcome to have with us Miss Melanie McQueen, who's the Director of Navigator Operations with the Patient Innovation Center, which was started in year 2 of the ACA and is in the planning stages of open enrollment for year 4. Ms. Melody was an in-person counselor and currently has a federal navigator license in the state of Illinois. Ms. Melody oversees 37 counties in the state of Illinois, servicing both urban and rural areas, has 38 assisters statewide, 12 of which are local here in Chicago. With much more that could be stated, I'm going to stop there and welcome Melody to today's program. How are you?
I'm good. Thank you, bro. Thank you. I'm good.
Thank you so very much for being here.
I'm smiling bigger now because I know who you are, so yeah.
I certainly appreciate you being here.
Thank you.
And as my first guest with the AIDS Healthcare Foundation, it was so appropriate. Mm-hmm. And the reason for it is because of the type of services that your organization is providing.
Yes.
Melody, if you would be so kind and let our audience know what it is exactly that you all do.
Sure. So I just talked about this smooth as butter a few moments ago. Watch me trip up now. Patient Innovation Center is a nonprofit organization that is filled with navigators. Our job is to assist communities throughout our 37 counties with applications in Marketplace or Medicaid, and we also assist people with SNAP as well, which they're always excited to hear about. Our organization as a whole has been doing it actually since year 1. But as Patient Innovation Center, our team of passionate navigators decided that this work needed to continue, and that's how Patient Innovation Center came about. wonderful thing that our organization has been able to do is break down the barrier of access to healthcare. We are able to meet our clients where they're at, whether it's at a hospital, whether it's at a overcomers meeting, reentry, the reentry population, and also at clinics. Libraries, we'll go to coffee shops. We want to make sure that you have a connection to someone that's going to help you throughout your entire process, not just filling out the application, but what happens after you've now chosen a plan, which is very new to people. We used to a medical card. So now that you have a choice of your doctor, a choice of the hospital system you want to be a part of, you need to really understand the ins and outs of that. And that's what we continue to do. So once that packet comes, we're there to help you post-enrollment as well, so that you use your healthcare insurance for all the preventative services that are available to you.
Let's talk about that client and those individuals. I know my family members are beneficiaries of it, and thank God I have a job, and one of these days, if I may need it, big shout to President Obama.
Yes.
The ACA, a lot of folks still are not familiar and do not know. How do you engage those individuals?
Yes.
Where do you meet them at?
Yes. So it's a number of ways. We're an extremely versatile group. First of all, to be in 37 counties, I could never do that alone. Our team is multicultural, totally diverse, and we look like our communities. So we're able to have those conversations with people in the community and have them understand, A, why it's important and what has happened. So what happened? In 2010, the ACA, the Affordable Care Act law was signed. And what that did was it expanded the healthcare opportunities for people who were, I want to say 19 to 64, single.
Okay.
And who were making, I believe it was 100% under the federal poverty level. So that would be making a single person making under $12,000 a year. You can now get health care. That was just amazing. That grew our insurance holders, policy holders, by 42% by that happening. And now, for us to reach people and tell them that this is now available to you, we do a number of things. A, we have hubs. Our sisters are stationed in hospitals. They are stationed at agencies and organizations that are resources for people. We're in the Department of Human Services, for example. And when hospitals have health fairs, we're there as well. Even in Aurora, the African American group in Aurora did an amazing health fair. We were there for that as well. We participate in parades to hand out information and let people know this is our number, this is where you can find us. Also, consumers go to healthcare.gov. And in that, or if you even go to Get Covered, and that's what happened during open enrollment. You were able to go to Get Covered Illinois.
I remember that early on.
And you put in your zip code, and once you put your zip code in, it will pull up what organizations are nearest you that have assisters that are available. Another option is we would also leave flyers everywhere, and you would be able to find our number, a number that would take you directly to one of our sisters to set up an appointment. So that was 3 points of touches. But really being out there, we also did canvassing. We would go into communities and public places where everybody kind of comes to, that corner store or church events, and hand out pamphlets letting them know that they can now get signed up if they want to, and everyone will be listed on that sheet of who they could get in contact with.
The number to call in, 312-738-1060. Give us a call if you have any questions relative to our topic and our discussion today, which is extremely important. A lot of individuals on Capitol Hill who fought against the Affordable Care Act. Some refer to it as Obamacare. But nonetheless, it certainly is, it's necessary. Melanie, let me ask, what are the numbers right now in Illinois? How successful are we? And then what specifically in Illinois are you reaching for?
Yes, so the numbers in Illinois, if you're asking how many people are enrolled, we're...
how many are enrolled and how many who are still uncovered?
We have, it's over 300,000 that are enrolled.
Okay.
Okay. And when you break that down, these numbers I don't have in front of me, but there is a number for marketplace enrollment, and then there's a number for Medicaid enrollment. That number for Medicaid enrollment, it has soared. It's really high. And but the number of people that still need to get covered is just as high. Our work is nowhere near done.
Give the audience, what's the difference between the marketplace insurance and the Medicaid insurance, or are they one and the same, or how do they differ?
Oh, that's an excellent question. Medicaid A is year-round, and it is based on the federal poverty level. So if you're a person of one, a household of one, and you make under $11,880, then you would qualify for a plan through Medicaid, which now gives you options. You may, depending on your zip code, you may have up to 10 options for a primary care physician and a hospital network. And that you don't pay for.
Okay.
Okay. However, Medicaid does have that stigma of, this is government help and I can only get this done or that done. But it's actually been expanded. The amount of care that you get has been expanded, which was also a part of the Affordable Care Act. For Marketplace, that is based on your predicted income for the year. So when you qualify for Marketplace, we do need to see tax documentation to help do that prediction. You are, again, able to choose plans, but in this case, you will have two things that are different. You'll have a premium, which is your monthly payment, and you may qualify for a tax credit if you're still within the guidelines to get a tax credit within the Marketplace.
How much time does your assisters or your patient navigator spend with the individual to help them, better understand? Because this is, even myself working in the professional healthcare field, is extremely difficult for me to really envelop and understand. Like, how much time, and I know a lot of folks are threatened by it because, their whole understanding of healthcare has been disrupted.
Right. So, okay, it's different. With a Medicaid application, a lot of my assistants can do it 15-20 minutes with their eyes closed. That's a simple application. When you get into Marketplace and now the consumer has to pay, they need time. They need time to really look at their household because it's based on who you have put on your taxes. Okay. And they also need to see, depending on if they have a chronic illness, depending on that, which one of these plans is going to best help me. And our assister is there to guide them through that. Then the consumer may say, I need some time to think about this because I wasn't prepared to spend $40 a month. I wasn't prepared to spend $100 a month. And so that part, as long as there's no glitches as we're going through healthcare.gov, then that could be up to 45 minutes to an hour.
Very important, ladies and gentlemen. 312-738-1060 is the number. We do have a call on the line. Caller, do you have a question for us tonight?
Hello?
Yes. Go ahead, caller.
Hi. So what I wanted to ask, I've heard recently, and I don't know this to be fact, that the rate for the Affordable Health Care Plan rather has gone way up, and I just wanted to know if that's true, and how much, is it still affordable for the average American who wants to consider that as an option?
Okay. I mean, you know what? We're having a little technical difficulties in here as far as hearing you. Can you please repeat that question for me?
Right. I got caught.
Sure. Can you hear me now?
Yeah, we're going to really listen. Go ahead.
Okay. I was just saying that I heard that the affordable health care rates, the price has gone way up. And I just wanted to verify if that's true and if it's still, in fact, affordable for the everyday American looking for, alternative health programs.
Thank you very much for that question. And just to repeat it,
yeah.
Yep. Did you get it? So have rates? The caller said that she heard that rates have gone up. How true is that? And is it comparable to the initial onset of it?
Okay. So first, let me start by saying everybody's definition of affordability is different. Some people feel that affordability means that it's free. Some people feel they're not getting anything of value if they're not paying for it, right? You get what you pay for, kind of a thing. As far as the rates going up, that is absolutely true. If I'm not mistaken, I want to say they went up 6%, 2 to 6% they went up, but I believe it was 6. However, the tax credit has not gone away. So if you are a person that has a chronic illness and if you did not have health care, your bills are in the 5 figures, easy. When you have health care and you're paying a premium of $125, it's a lot different than trying to figure out how you're going to pay a $20,000 or $80,000 bill, and that's just from one visit. When you're sitting with a navigator, you are able to make the decision on whether or not this is affordable for your pocketbook, right? And one of the things that we're trying to change as we're working with people is we need to value ourselves. I'm worth more than $80,000. I'm worth more than $100,000.
Sure.
And even with our young people who value things, cars, shoes, jewelry, we want them to invest in their welfare, their whole body wealth, body, because that is wealth. Being healthy is wealthy.
Absolutely.
And be okay with making sure that you have insurance on yourself, because you never know what's going to happen. So yes, it did go up, and the definition of affordability varies from person to person. We have people who will say, I'll drop $400 on there a month as long as I know my body is fully covered from head to toe. If I can walk out the hospital and I don't have to see a bill, that I'm going to pay that.
Got you. 312-738-1060. My caller assistant today is Aaron Fletcher from Southside Help Center. I certainly appreciate Aaron. Aaron, do we have another caller? Caller, go ahead and welcome to tonight's program.
Hi, thank you for taking my call.
Hi, how are you?
I'm great, thank you. I have a question. I'm 28 years old. I have a employee sponsored health care, and I didn't know which. I have a PPO, and I didn't know if I should go through and look through the open market, or should I stay with the employee sponsored health care?
Yes, if your employer offers you health care and it meets the minimum essential benefits that it should have due to the Affordable Care Act expanding services, everyone needs to have a certain level. There's now a certain standard of services each healthcare provider needs to provide. As long as your employer is offering the insurance, then you look that over and make sure that that's something you feel is conducive to your budget, and go with your employer's insurance. It may be cheaper than the marketplace insurance. If, in fact, your insurance through your employer is over the budget, I believe the calculation is over 30. It's supposed to be 30% of your income. If it's over that and it's too much for you to handle, you can opt out of it. But I would look at both. I would look at what your employer is offering you, because it may be a better rate than what you would get through the marketplace. But you can always get screened and find out.
Ms. McQueen, let me ask you this question, because that's a very good question. I work in a place where we do have health care coverage, and not to be redundant with the caller's question, so how do you figure that? And I know I work with folks who, we're at different salaries.
Yeah.
Some of us on a higher end than some who are on lower. How do we really make the better distinction? So do I take my company's health care coverage versus me going to the marketplace? What are some indicators? Is there a cheat sheet that we can use? Is there a certain amount of money that we can say, okay, if you're making this amount or less, you probably should seek the marketplace versus
Yeah.
how sticky is that?
It is. I really wish it was that easy, but when you're in the marketplace, it's all based on what you're claiming on your taxes.
Wow.
So, how many people are in your household? What is your net income? What is your modified adjusted gross income? Like, all of those things have to be calculated before you even decide, before anyone could even decide. That's why when you go into be screened at healthcare.gov, if healthcare isn't even an option at your job, then you're able to figure those things out before you even get to a plan.
That's why you guys are so necessary. And I know we're coming up against the clock. I want to make sure that we get all of that information out as far as how to get in contact with you. In addition to that, direct contact information as well as the website. We need at least 2 hours for this, or plus. There's just so much information that we need to convey and get out there. So, Ms. McQueen, again, because you've said a couple of websites, if you can slowly walk me through them,
so
that our viewers can get it.
Absolutely. So, the first thing is, I'll find the phone number in a second. I thought I had it right here at the top. The first thing is you can visit our site, which is www.patientinnovationcenter.org. You can also go to healthcare.gov if you'd like to screen yourself. I do want to mention really quickly, anyone can go and try to muddle through the application process, whether it's for Medicaid or for Marketplace. The point is you come across questions and things that they're asking for and things that they're saying you qualify for that just don't make sense. And you need someone there that can explain to you why they're asking for this or why they're going to deny you for that or whatever supporting material you need to bring. So don't think you can't try to go through it alone. It's just better together. It's better when you have someone helping you. So that's healthcare.gov. And you can put in all of your household information. And remember, according to Marketplace, your household is what you have on your taxes. So let's just say you're helping a brother out, but you have a wife and 2 kids. He's not on your taxes, but you're taking care of another person. Marketplace needs to know who it is that you are accounting for on your taxes.
Understood. Right. That gets very sticky. I know a lot of people who do a lot of funny things on their income taxes.
Yeah.
What's a phone number that folks can reach you at? Because I know there's a million questions out there that are still lingering.
Sure. The hotline that you can call where I can get you connected with the navigator right away is 312-548-3700. Again, that's 312-548-3700.
Ms. McQueen, thank you so very much for being my guest here this evening.
Thank you for having me.
And you know we will be having you back, and we'll give this number out and the website just one more time. Just want to make a quick announcement to everyone out there. Again, my name is Kendall Moore, and this is the AIDS call-in live number. On behalf of the AIDS Healthcare Foundation and Southside Help Center, for those individuals who are affected and or impacted by HIV and AIDS, we do provide services. You can reach us at southsidehelp.org or ahf.org. Our clinics are located at 2600 South Michigan, the lower level D, 1515 East 52nd Place, and that is in Hyde Park, and 10420 South on Halstead in the Roseland area. I want to thank you guys for your time this evening. You can reach us at Southside Help Center, at 773-445-5445. And again, at southsidehelp.org and ahf.org. Thank you guys for your time. Ms. McQueen, thank you again.
Thank you so much.
For your time.
Awesome.
I want to thank my caller assistants, Miss Erin Fletcher. And folks, if you want more information again on the Marketplace and Medicaid and all of the other things that is connected to the ACA, which is the Affordable Care Act, the websites are patientinnovationcenter.org healthcare.org, and those numbers.
Healthcare.gov.
Healthcare.gov. I do
Yes.
appreciate. I'm sorry about that. And the number is 312-548-3700.
Yes.
That'll do it for our time. I'll be seeing you soon. Want to thank Sylvia Snowden per usual. And folks, if you want to get in contact with me, very simple. It's kendall.moore@aidshealth.org. Want you to enjoy the Taste of Chicago is happening while you are there. For the rest of this week, be safe this summer. Make sure that you get signed up. If in fact you are not signed up for a healthcare program at this point, it's critical. And we do have a presidential election that is coming up, and it's going to be critical for you to get signed up, because we do not know what is going to happen with this next presidential election as I smile. All right, folks, that's my time, and we'll see you next time.